So, a very warm welcome to all of you who have joined us today. I'm Neeta Tyagi, and I'll sort of work with you or soon be interacting with you in my capacity as Director for Partnerships and Growth at Eager Foundation. And my focus is more health and sanitation. I'm joined here by the product team, Jojo Mehra, who's the Chief Product Officer, and Ronald, who's the Product Manager for Digit Health. So you are all aware that at Eager, we are in the midst of development of Digit Health in the context of Mozambique. Digit Health is a health campaign management platform, and there's a huge sense of excitement and multiple forces joined to make it a successful exemplar. As we together look for the next set of countries, we foresee this select group of partners working together in the near future, some as program partners, implementation partners, as funders. And I guess the common sentiment being what is best for the country. We feel it is very important to have a common and shared view of Digit and Digit Health if we have to determine what is best for the countries. And secondly, we also feel that as we approach these countries which have digitalization as a priority agenda and may have legacy tools and solutions. So apart from this common and shared view, what matters is also the framework which is used to hold these conversations, and the win-win conversation framework is undoubtedly the best. And by that I mean that if the conversations are focused on how existing systems stand to benefit with Digit Health and vice versa, it raises the level of conversations much higher than a feature by feature comparison, which can only be a win-lose or a lose-lose proposition. So this is precisely the reason why we have arranged for this 1-hour session for the select group of partners, and happy to do more if we get a thumbs up from you. So Jojo, before we start, what are the 2 to 3 takeaways you wish for our partners who are here today with us to leave with post this session?
Thanks, Neeta. Yeah, I mean, it's a discussion, and we were keen on kind of sharing the work that's been going on, at eGov's end on what we're building as part of the digitizing health campaigns. So I think one of the key message that will be interesting, and I'm keen that people take with them, is saying that it's beyond a tool. It's really about the approach, and what we're talking about is building out the digital public infrastructure for health. It's a different approach. Definitely, there are solutions, and the health campaign management product is a solution, but it's not about that. It's beyond that. So I think that's the first message, so to say. If we can have that as a takeaway, it'll be I think it'll be a good hour spent.
Any other?
Yeah. So the next one, we were just making a note of it. In fact, the next one really is saying that what you kind of alluded to in your introduction, that ultimately countries and sovereigns, right, need to be able to own their digital transformation roadmaps, right? And we'll speak a little bit about that through the course of this webinar. It's not about taking one solution and aligning all your priorities to that solution. It's the other way around, right? That technology really has to work for countries and for sovereigns, and they should be able to own their digital transformation roadmaps, and it needs to empower the partners and countries. But the third one to you, Neeta.
Yeah, and I think I have it right there. A message to my partners would be that whenever you introduce us, introduce us as digital transformation partners and not as vendors. So I think that's my wish list. So maybe now we can get started, Jojo, with, I think if you can take our partners through the platform approach, which you were just alluding to.
Cool. So I'll start with that. And if you can, and just to kind of lay it out there. So this is while we're working on building out the health campaign management product on Digit as a generic product. It's very much in the context of Mozambique, right? So for us, Mozambique is almost a pioneer in this, and we'd like to view it as that. So when you're seeing this, please see it from that sense. Towards the end of the discussion, we would be going through the roadmap, etc., and that's going to be more generic. right? But I'd like to start off with looking at how we're looking at approaching the digital transformation of health campaigns in Mozambique. And when we started looking at trying to understand the space, right? What we came out was that, LMICs, the low and middle income countries, face multiple challenges when it comes to health campaigns, right? We broadly kind of categorize this as three actors, looking at the health ministry, right? The things that are happening at the national level. We looked at people who are, our health supervisors and program people, and people who are actually on the ground as your frontline workers. And, when we looked at, and of course, the challenges are many, right? But when we kind of brought it down into the key things that really matter and make a difference was, say at the health ministry level, we were able to see that there is very little visibility on the progress and the problems in real time. There is very little data to plan, to make decisions, not only in planning for the campaigns, but also in real time when the campaigns are running. When it comes to program managers and supervisors, right, people who are handling warehouses, people who are running the programs, there's again inadequate information and limited resources. They seem to be constantly firefighting, right? And imagine doing that with very little information. For frontline workers, the common thing that we understood was that there's limited training. There are issues constantly cropping up at runtime. There are repetitive tasks, delayed payments, etc. Right? So it's very, very transactional to that very specific actor, which stops them from doing their work. As a result, it hampers the entire campaign itself. We broadly bucketed these at the bottom, if you can see, into 5 key challenges, which leads to a low campaign effectiveness. It leads to complexities on logistics. There's very little visibility. What came out was that the approach is completely siloed, and at the end of it, there's limited ownership, right? And all of these are interlinked problems. We'll spend some more time, and we try to gather, on the next slide, please. We tried to gather some evidence around it. And we said that it's not as though countries have not been doing digitization, right? They have been doing the digitalization. And what we saw was that if you look at the last 4 years, about 50% of the campaigns don't complete, right? And this is even with digitization. So this is, of course, with digitization, without digitization. And that got us thinking, saying that, hey, this needs to be something, there's got to be something about the approach that needs to work. What we figured was that, and what we learned from our multiple conversations, from our conversations with our partners, is that countries are rapidly digitizing campaigns to address these challenges that we mentioned earlier. Our understanding was that the current digital efforts are suboptimal and will have low impact on effectiveness. And the key reasons that we identified from that was that, one, there is a duplicative approach. I'll spend some more time on that again. All the data that's being generated is being generated in different systems, and they don't talk. This is not only across different campaigns and disease types, but also within the same campaign itself, within the same disease type itself. There is multiplicity of systems. There are multiple systems, and there is no interoperability in the systems. As a result, what ends up happening is it's very, very difficult to scale these digitalization initiatives, and it's even more difficult to sustain them. And finally, what came up as a challenge was that there is very limited ownership on both the digital assets as well as the data with sovereigns, right? And it limits their activity, it limits their ability to act. So our thought around this is that, taking the approach of digital tools or an application first kind of approach doesn't really solve this problem. And what you really need is a slightly different approach. And I'm going to spend 2 minutes on this slide. The current approach of digitalization, right? And this is true of many other systems as well, as is not just specific to health campaigns, is that you've got multiple actors, right? So you have citizens, you have administrators, employees, vendors, frontline, workers, etc., who use these digital systems. So it could be an app, it could be a system that they're running, from the headquarters, etc. And for each use case that they come up with, you come up with an application, right? So you have an application that's there for planning. There's an application that's there for registration. There's an application which is there to track inventory. Then you have a dashboard, etc. Right? And each of them captures its data in a separate database. And then what you try and do, because you're trying to make the system work, you try and have an integration, a point-to-point integration between these multiple systems. Now, initially, it tends to look okay. But as the system evolves, as you add new systems, as you change a current system, the entire system just comes to a standstill, because now you've got to change those point-to-point integrations across multiple systems. Now, imagine this happening for multiple diseases within the health spectrum as well, right? So you're looking at polio, maybe you're looking at malaria, looking at measles, et cetera, et cetera. Each one of them now have multiple systems with multiple databases, and hence it becomes really hard to make any change, and becomes even harder to scale any of these initiatives, right? The platform approach, in fact, looks at these. So, this is it's a representative view. It looks at this as a stack, right? So now just imagine at the bottom layer, you've got your shared registry. So that means when you're talking about your users, when you're talking about your households, when you're talking about individuals, right? All of this all this data resides in a shared open registry to be used by any program and multiple programs, right? On top of that, when you're building out solutions or applications, there's a core set of capabilities that are used by all these applications, whether you're building a frontline worker app, whether you're building a dashboard, whether you're building something that is used to set up a campaign, it ultimately uses a common set of components. So you don't need to reinvent the wheel. You can basically leverage and reuse the same set of components that are defined using common specifications. On top of that, now you can have multiple programs, you can have multiple applications, multiple solutions used by different programs. And that's the idea. And when you do it in this way, what you're essentially doing is you are unlocking this data. You're making sure that the data doesn't reside in silos, and it increases your ability to coordinate and collaborate across different departments, different campaigns, different disease types. Right? In a nutshell, what we're talking about is, these four things, and I'll spend a minute just going through four of them, right? So first, we spoke about having reusable building blocks, and I'll spend a few minutes after this slide explaining what these building blocks are, in case we've not kind of gone over it earlier. What it really does is that it allows your digital assets to be reworked and reused across different campaigns. What it solves for is that you don't need solutions for each type of campaign each time you want to run a campaign. The second part of it is having shared data registries. This serves as a single source of truth to create and use data across campaigns. For example, once you have your base data set up, you can actually avoid repeated enumeration. You can leverage data that is already there and enrich that data. What it solves is that it solves for this entire approach where data is currently siloed in multiple databases. The third one is about interoperability. This is a space where there will be multiple systems. You need to have interoperability baked into your platform that allows you to coordinate at scale. For example, if there is a DHIS2 in the room, you've got to be able to interoperate with it. And coincidentally, we're doing that in Mozambique. And finally, the fourth pillar, which I think is really important, is that it's free and open source. Countries can own, like I said in the beginning, they can own and evolve their digital assets as they own public digital infrastructure. It also helps them save costs, and that money, those resources can be reused for actual health interventions, whether it's buying more bed nets or it's more resources on people, it's improving wages, it can be reused for those things. I'm going to take a few minutes going through each of these. For example, let's go through the building block approach. It's quite straightforward, conceptually, but if you move on to the next slide, right? So just imagine that your first part of it is the problem, right? Now, when you're building out a solution, you have two options in front of you. You could either build a tightly integrated end-to-end monolith solution, or you could build a solution that is an aggregate of smaller reusable components. Now, if this is your problem, there's not much difference at this stage between a tightly knit application versus taking a building block approach to build the same solution. Now, however, and I think all of us in this space appreciate this, that anything that you build is not stagnant, right? Solutions designed for a specific context will serve you once. They become very, very hard to evolve, right? There could be a change in policy. There could be a change in your procedures. There could be a change in your processes. And the minute that happens, your existing monolith application stops being effective or stops being useful altogether. The advantage with going with a building block approach is that you can literally change or add one building block and keep on evolving it as your problem space or as your context changes. The example that we were looking at in Mozambique, for example, and this is a real thing that actually happened for the first version that we're looking at a rollout for a BedNet campaign later in the year. Complaints or the ability to manage complaints wasn't factored in as a key requirement for the version 1 rollout. And then once my colleague Nunal, who will talk to you a little bit later, went out to the field, said that, this is going to be needed because of the way the campaign is structured. And at that point in time, it was a no-brainer for us. We said, okay, no problem. We just take a campaign building block, which is a complaints building block, which is already built on Digit, and make sure that it works with the health campaign management product. And now it's a part of version 1, right? So it's easy to do these things. And this is just a demonstration of how your entire solution can actually evolve as your problem evolves as well. The next thing that we'll talk about is the second pillar, which is looking at data. This is, again, I think it's self-explanatory. Right now, when there are multiple systems, even within the same campaign type, data resides in separate databases. It's a separate activity now to take the data, harmonize it, synthesize it, and then make it usable. If you work with shared data registries, this data is not only readily available in real time to your specific campaign, it can be used by the same campaign at another date. Plus, the same data can be used by many other different campaigns, right? It allows you to rethink campaigns itself and makes the data really actionable while the campaign is running in real time. The third one really is about looking at APIs to be able to go and exchange this data. And this speaks to interoperability, where we know that there are multiple systems in this space. If your APIs are standardized with open specs, you can interoperate with existing systems. This is not there to replace other systems. It's to work with many other systems, because that is what it takes. And every context that you go into, every country that you go into may have, in fact, will have multiple systems in play at all points in time, right? So this just makes it easier once you have standardized open specs with open APIs. So this is in a nutshell what this approach allows you to do. It looks at digital sovereignty. It gives you strategic agency so they can evolve their own product, and it enables participation by the ecosystem. This is something that Neeta will talk about a little later in the presentation as well. And this is fundamental to how we look at this entire approach, right? So this is how do we enable collaboration and participation by the entire ecosystem to be able to go and solve a problem. And there are some examples that eGov has in its history, working across the urban space, working across sanitation, and it's exactly what we've done even from the beginning. In fact, when we'll tell you how we came up with version 1 as well, it was working with others that we actually learned about health campaigns and the role of digitalization within health campaigns itself, right? And this really enables that approach. So when these four come together, right? So what does it actually allow you to do? One, health campaign management as a product can be repurposed for all campaigns. These can be individual campaigns, these can be household campaigns, single round campaigns, multiple round campaigns, campaigns for malaria, but campaigns for other disease types as well. The second thing that it allows you to do is you can do your enumeration once, and then you can continuously enrich that data. It allows you to make sure that data flows across systems, solutions start to interoperate, data is not locked in. You can use the same building blocks to evolve your own solutions for your specific context, or you can use the same building blocks and many more that are available on Digit to create many more new solutions. You see the star asterisk over there on that. That's basically pointing out to the fact that there are multiple solutions, 29 solutions that are built on Digit Urban. These are done by partners in the ecosystem. This is not done by eGov. eGov set out to make 9 or 10 reference applications, give it to the ecosystem. We spend a lot of time and energy making sure that partners are able to, they understand Digit. There's a lot of effort that goes into training, into certification, etc. And again, Neeta will tell you a lot more about it on how that is core to what we do. This is not an add-on. The fifth point is it lowers, because the entire system and health campaign management as a product is free and open source. It lowers your costs of software and of running programs as well. And finally, the point that I've been stressing, I think from the first slide, is that it allows sovereigns, it allows countries to own and evolve your own digital assets as your own public infrastructure. So I'll stop with that.
Thank you, Jojo. I hope our audience, our partners share the excitement, like I said earlier, about what is happening in Mozambique. And I request participants to put any questions that you may have on the chat. If we have time after the session, we would love to take up 1 or 2 questions. So I think, Jojo, maybe now you can take us through, or you're now, how you got the version 1 of the product, so that
So we'll do that. And just a very quick, we were coming to that on. So it's been an exciting journey coming up with version 1 of the product. There's been a very, very steep learning curve, and this is with the partners out there. We very, very early on. So this was last year. I think we had got the opportunity to interact with some of the people who are really familiar with the space from Path, and we're calling up the name because we did a field visit to Gorakhpur to see how a campaign is being run in real time. We got a sense of how it's done. After that, the team has spent a lot of time in Mozambique itself. We spent a lot of time in Mumbai, and Ronald, my colleague and the product manager for health campaign management as a product, will take you through the journey with some snapshots of how it actually came to be.
Thanks, Jojo, and thanks for covering the journey as well. So we are halfway through the presentation, and the other parts that are pending are basically the journey that we undertook, I think, starting back in April. And what did we do? How did we learn and evolve our understanding, and finally came to an understanding of what version 1 of the health campaign management product should look like. So I'll quickly run through these slides and hopefully spend more time on the roadmap part that is at the fag end of the presentation. But before I begin, just a call out and also a sense of gratitude for all our partners who helped us get this understanding in place, helped us navigate through tough waters. So the NMCP malaria program from Mozambique, Clinton Health Access Initiative, CRS, the Gates Foundation, and also Path, as Jojo mentioned. So our journey basically started back in April 2020 when we did a field visit to shadow a MDA campaign for LF in Jharsuguda, followed quickly by MDA campaigns in Gorakhpur, which is a state in India. We also looked at IRS campaigns in Kushinagar, again in India, and then finally we also looked at a village nutrition day and a routine immunization day. So the idea of going broad across the spectrum was to get an understanding of what are the different types of campaigns, what is similar, what is different, and how do we make sure that the product that we build satisfies all these use cases. This was basically to get understanding of the landscape and understand the campaign ecosystem, and we did these visits with Path. Once we had a basic understanding and once Mozambique was on board, what we did was we went and spent a couple of weeks on the ground. We observed the actors, we saw how they interacted with each other, how was communication flowing throughout the system, how was training being done. So all aspects of the value chain, we tried to observe that, right from the campaign planning, the micro planning phase, that is the first image on the slide. going into execution, basically the stock coming into a particular district warehouse, it getting delivered to the actual beneficiary, the households, and then the whole monitoring right from the ground to the central level. We shadowed all of these activities to get a deeper understanding of the space. Once this was done, we went with the design and the development. The engineering team put their heads together and built the product as per the requirements. But then we weren't very sure whether it would work for the users as we envisioned it to be. So just to validate our design assumptions, we did a quick usability test with the BMC, which is the Mumbai Municipal Corporation. There was a primary health center. We reached out to some ASHA workers who are the frontline workers working on campaigns and other initiatives, and gave them the application to use and saw whether they were able to use it the way we thought they would. And the results were fairly great. After doing this, there are a couple of activities planned in Mozambique. I won't go into that right now, but the point being, we validated our understanding with multiple subject matter experts. We validated the product design through UATs and usability tests and field visits. And finally, that is how the version 1 of the product was formed. We'll go a bit deeper into version 1, but before that, I would like to Anita, if you want to add something.
Yeah, I think thank you, Mrinal, for taking us through how you got to the version 1 of the product, but obviously this is not all. And I think Jojo, if you can help our partners understand what is really the roadmap, what it is one going to get when there is a final product. Also pointing out, like you said, every country in the context of their own challenges might need to evolve their own roadmap. So how does Digit help empower our partners in that? I think that story will be good to have. Thank you.
Thanks, Neeta. So we've broken this into 2 views, right? And first, I think we always think in terms of, hey, how are people actually going to be using this, right? So so there are 2 views that we have. One is we're going to take you through how does this change the life for the different actors that we mentioned, and of course there are clusters that we have drawn. So we've drawn clusters of the frontline workers, the program managers, and and the health ministry as such, or the health department. They're broad clusters, but it will give a good sense of what the capabilities of the product are, and then we'll go down into a more detailed roadmap that shows you how version 1, version 2, version 3 is looking at this point in time, and then we can also do a deep dive into what the capabilities of version 1 are, right? So broadly speaking, when we're looking at
I think we've lost you, Jojo.
Are you able to hear me?
Now, yeah.
Is the connection back?
Yes, now.
Okay. Yeah. So I was saying, when we're looking at health campaign management, the whole idea is that we should be able to run campaigns for all diseases. And I'm going to put these 5 broad capabilities that we've looked at. One is people should be able to go and set up a campaign very quickly. And this includes everything from the campaign setup itself, to user management, to role assignment, to being able to go and create forms easily, et cetera, et cetera. It needs to enable integrated planning, both macro and micro. There are lots of operations that happen, and that almost is the core of of many of these apps. Is it needs to be able to streamline operations, and this includes everything from having a help desk to manage trainings, to looking at complaints, to managing inventories, automating payments, etc. It needs to simplify delivery. This includes both registration as well as service delivery. And how do you enable people with simple checklists or in-app job aids, etc. And finally, there needs to be real-time data for making decisions, and also being able to have tailored reports that different teams can use to inform their operations on a day-to-day basis, right? At the core of it, the health campaign management product is so there are 4 ways to think about it. There are 4 things to keep in mind when thinking about it. One, it's modular, it's configurable, all the building blocks are reusable, and it's easily integratable, right? So I'd leave you with these 4 before just going down into an actor-specific view. And again, I'll run through this. This is not all of it is not present in version 1, just to kind of lay it out there, and we'll give you a sense of which ones of these are in version 1 and which ones are not. But when we think about the entire health campaign management product holistically, right, we're saying for the frontline workers who are, are key actors in this, in campaigns, it needs to function as a digital partner, right, where it needs to be an easy to use app with offline capabilities. We know that in a lot of these places, internet availability is a challenge. The entire flow, even on the interface level, needs to be guided, and they need to have some support from analytics that tell them about simple things. All your routine tasks need to be simplified. There need to be built-in checks to reduce errors, because if your data quality over there at that point in time is maintained well, it becomes easier to have robust, trustworthy data to make a decision at an aggregated level. And finally, it needs to have the ability of providing on-call assistance. So there are 4 simple things that we would look at, and I'll breeze through these. One is, simplified routine tasks that includes things like checklists, proximity-based search, GPS navigation, etc. It needs to have quick support, and this is an in-app walkthrough, a guided user flow, a one-click call to the help desk. It needs to have your app needs to be ready for the job. And again, this is looking at conditions that most of these frontline workers operate within. So it needs to have offline capabilities, error checks, needs to have access to SBCC material, it needs to have reminders, job aids, etc. And finally, it needs to cover the basics, of course, right? So your registration, service delivery, search, the proof for the work that is done, smart payments, etc., and need to be there. If you're looking at managers and supervisors, our way of thinking was that, hey, this needs to be like a co-pilot, where it needs to enable managers and supervisors to run campaigns efficiently, where a lot of the work that they do involves tracking training, registration, service delivery, complaint status, looking at the complaint progress. And finally, can they drive effectiveness of these campaigns, looking at real-time data as well. Again, in terms of core capability sets, they need to be able to plan their campaigns inside out. This includes micro-planning, target setting, looking at your stocks and storage, team distribution, transportation planning, staff management, etc. It needs to enable managers to be on top of operations, right? So you can plan and monitor your trainings, you can look at attendance, you can manage your payments, you can track complaints and stock management. And it needs to have essentially a lot of data to be able to go and make a real-time decision, whether this is about looking at complaints or training or performance of staff, etc. Right? Finally, when we look at health campaign management and the purpose it serves for health ministries and departments, is that it needs to serve as a digital headquarters, where they need to be able to go and set up and configure multiple campaigns, track campaign progress, measure the progress through real-time data dashboards, improve effectiveness through centralized help desks and complaints management, right? If they can do this, that it's functioning as a real digital headquarters. In terms of the capability set, very quickly, they need to be able to go and set up and launch these things, which includes the campaign setup, user setup, role management, and ensuring that all the data that they are setting up can be configured very, very easily. They should be able to go and look at and manage and man a central help desk, have access to real-time dashboard, and be able to define their own reports at what frequency depending on the campaign type. And this needs to be really simple to do. And finally, you need to have easy integration. We said that this was in the context of Mozambique. So we're looking at DHIS2 for Mozambique, but if there are multiple other DPGs and multiple other products out there, Digit and health campaign management should be interoperable with all of those. So that was one view. The second view that we're going to be taking you through is now, how do these capabilities pan out across different versions, version 1, version 2, and version 3, and this is across a time scale. What we're looking at now, right now in the next couple of months, going live in Mozambique is version 1. And I'm going to hand over to Mrunal, who will take you through a deeper dive into the capabilities of version 1.
Thanks, Jojo. So like Jojo said, this is how the roadmap is going to execute the vision that Jojo just spoke about in the last couple of slides. One aspect that is missing here is the timeline of version 1, version 2, and version 3. So usually our cadence for releases is every 3 to 6 months. So every 3 to 6 months, there would be a new feature, a new capability that is in the pipeline and would be released accordingly. I will come back to this slide and talk about version 2 and version 3 at the end. But before that, I just want to do a double click on all the capabilities that we are looking at for V1. And this is the product that would go live in Mozambique in August. Jojo mentioned at the beginning, it should not be a point solution only for an LLIN campaign or an IRS campaign, or for that matter, something else. It should be a product that can work seamless, irrespective of what campaign you are configuring it for. So a lot of the platform is highly configurable. The product is highly configurable. And that is why the first version that we are going live with can support any single round campaign, whether you're registering households and delivering interventions to households or for individual beneficiaries. So the 3 campaigns that we have in mind and we have tested our app on is obviously the LLIN campaign, which we will be piloting in Mozambique. Similarly, the app can be tweaked and pivoted to work for an IRS campaign just as easily. And finally, for a single round MDA campaign, we can make that work as well. Coming to campaign and system setup, the quick setup and launch, turnaround time. We know we have to launch a campaign. It should not take a lot of time to go and set it up. So there's an easy interface for creating users, giving them roles, assigning permissions. All of this is configurable and through a UI. Also, creating a campaign, whether you want to run a campaign only in one particular village on an administrative boundary in a country, or whether you want to do it at all levels, whether it is a hierarchy or a standalone campaign, the way the product is designed is that you can cater to both use cases. You can also configure the mobile application that the frontline workers would use and the dashboards to support any language. So again, it's just a matter of uploading an Excel which says the English version of this word is X, in Portuguese or in Hindi it is Y, and that's just as easily you can upload it. And just stressing upon it is configurable. So what you see on the screen, if something is not as per your requirement, you can easily change it. You can add new fields, stitch screens together, use it separately or in conjunction with each other, and it will just work fine. Going on to the next, registration and delivery. So again, whether you want to do it together or as separate modules, you can do that. You can configure rules to automatically calculate how many resources have to be delivered to a beneficiary. Whether you want to do a door-to-door campaign or a fixed campaign, you can do that as well. There's also a setting in place where you check for a duplicate entry before creating new. So duplication is also handled to some extent. And like Jojo mentioned, data reuse is enabled. Going to the next, monitoring and supervision for the monitors and the managers, dashboards, custom reports can be generated. It can be scheduled. You can also export your dashboards and send it to somebody else via email or WhatsApp. Supervision checklist. So these are basically configurable forms that you can create and render. And finally, the complaint part. And I think Jojo already spoke about this. All transactions that happen in a warehouse for stock movement are captured, and also an auto reconciliation to keep the warehouse manager abreast of what are the stock levels in her warehouse are also put in place. So this was a briefly about the version 1. Similarly, version 2 talks about extending this product to support multi-round campaigns as well. Each capability that I just listed in version 1 will also mature over time. Examples like geo-guided routing assistance, proximity-based search for registration and delivery, all of those things, getting attendance into the application, having awareness checklist integrated in the application, supporting training, payments, planning. Those are the things that we have planned for V2. And again, in V3, along with what we've already done, doing a integration with WhatsApp for effective communication, having due list generators, form designers, so that a non-technical user would also be able to set up a campaign and use it just as effective as a tech resource can. So this is a view for the next couple of months. And I'll hand it back to Neeta to take it further from here.
Yeah, so this is on your screen. You're basically seeing an abstracted view of the health campaign platform itself, for anyone who's a little more, is interested in which are the actual building blocks within the campaign. You can take a screenshot of this, or it's going to be available on the Digit website as well. But Neeta, a question to you, and I think we can move on to the third part that we said we will, we want to kind of cover in this, that when we look at digital transformation, how do we look at the role of eGov and the difference between being a partner and a vendor, right? So, but over to you, Neeta, to take us through the finish.
Thank you, Jojo. So yes, I think that was my ask for our partners who are here today. Thank you everyone for your patience. I think the whole idea was to help you gain a very common understanding of digital health as you talk to countries. And as you do, my request is to bring us in more as a national digital transformation partners than vendors. And the reason why I say this is pretty much summed up on this slide, because at the bottom is what eGov does. It creates digital public goods which are used by countries to put together the infra. And this has, what Jojo was talking about, all the common elements. And it's not really funny, but when eGov is now 20 years old, and when we built this digital infra and thought that people will come and build on that, actually nothing happened. And this was a realization sort of 6 years ago, that if you have to scale, then you have to invest in enablement of the ecosystem to come and co-create and build on top of it. So the second layer that you see, enabling and capacity build, I'll request Mrinal to just go down the line, because this is what is kind of, if I expand it on the next slide, Mrinal. So eGov basically now spends, for the last 6 years, more than 30% of its time, effort and resources for partner enablement. And I think that is a very important point to sort of land in this conversation. So if you look at whether it is in terms of the infra and the references, the open specs which are there, the reusable microservices, you can see the numbers, I'm not going to repeat that. But the first part is really about the open, references which are there for a state team or our partners to pick up. And then the second is the engagement plan that we do through the training and the tools which are there. So you look at the number of hours that we have spent on training, the number of resources that have been trained, the playbooks and the guides. And I think that's what leads to the scaling up, which is when the ecosystem, we create an ecosystem of solvers. And those who will be so like there's a number mentioned, 42 solutions which were built in the context. And I think this is what Jojo, you meant, that a roadmap of a country is very contextual to their challenges. It's not something that one person, one organization sitting anywhere can, even think of them, but you give them the building blocks by which they can create their own ecosystem. We can go back to that previous slide. So what happens is, through this investment in enablement and capacity build, the ecosystem thrives. And as there are a number of logos here of big and small partners, and this is in the context of India. And on top of that, what you see is the scaling up, how the multiple programs have been built leveraging Digit. And if you look at all the sectors, Digit Urban, Digit Health, Sanitation, or public finance, 80% of their core is actually from Digit. Only 20% is based on the domain. So what you see is a proliferation of programs which are out there using the same Digit core in urban governance, in health, in water, and in sanitation. So I think, again, driving home the point for all our partners that as you talk to the countries, you are not bringing just a solution or a tool, you're bringing home an infrastructure which can evolve, and this empowers our partners who are closer to these countries to help in that evolution by building more solutions on top of it. I think probably that's the reason for my request, to our partners here as you introduced us further. I think that brings us to the end of our webinar. Happy to take if there are any questions from anyone in the audience. I think we have from Gregory. Thank you, Gregory, for your comment. It's great to know. And in fact, we had a call before this with MicroSafe Consulting on your work in Africa. So thanks for your comment. And we will be setting up again calls with each one of you. I just wanted to say we'll be sharing this webinar, we'll be sharing this presentation. But it'll be great to get your thumbs up or your views in terms of how this was helpful. But we will be back with similar sort of sessions on any area that you as our partners wish to strengthen your understanding on.
Yeah, so I just want to add, since we were also talking a little bit about working with partners on version 1, and I think I started off with path, but I did not say the role of CHAI and the role of BMGF and the role of CRS, where we've already got a lot of inputs from multiple partners while BK came up with this current roadmap. And we're looking forward to engaging with a lot more partners. And like Neeta said, we would be having these sessions at a regular cadence where we can hear on what are the specific needs of different countries, and which country is looking at looking at leveraging what has already been built in their context, right? And that is what will really inform our roadmap going forward. So I just wanted to kind of put that out there, that this is not, we would be having multiple such sessions.
I think, Jojo, there is a question from Gregory.
Yeah.
What are the particulars of the Mozambican context that shall affect your implementation of Digit there?
So I can, and we can share this question between Kunal and me. I think he's made a lot more visits to Mozambique than I have. But I think our understanding is saying that, hey, what are the realities of Mozambique for a very specific campaign, right? So I'll tell you how we look at this, Gregory, right? First, we try and understand what does Mozambique really need, right? From what they're trying to do now. But in the way that these building blocks are designed, they are designed to be generic. So it will not only work for that very specific context. It will work in a generic manner, like, but it will definitely solve the problem for what is being done in Mozambique, right? And that is overall the approach. The approach over here was focused on an LNIN campaign, which is going live in August. So the entire version 1 was focused around that.
I think, Jojo, the offline, sorry, I might have deleted that question from Q&A even before it is responded. Apologies for that. But I think the offline feature is something which was a very important aspect,
Absolutely.
Which I think because of the platform approach will be available to entire continent.
Absolutely. Absolutely. Yeah. And in fact, that's a capability that now that it is being built for in a way, starting off with Mozambique, it's built in Digit. There is already a realization that this capability can be used in multiple other contexts outside of health as well, outside of health campaigns as well, right? It can be used in sanitation also. And there already a conversation where the state of Odisha in India can actually pick this up and try and use the offline capability. So similarly, what is getting built, as part of sanitation, as part of other things, like, say, for example, attendance is getting built out in Digit. And we know that it is part of the roadmap for health campaign management, which will be used in multiple countries going forward, right? So that's how we look at the roadmap at a core capability level.
And at a very high level, Gregory, thanks for this question. I think the biggest challenge as we were going to Africa was to realize the low resources. And it has been a huge challenge for Digit team, to build in that context. So I think low resources, offline capability, I think these were the key ones.
Yeah. Just to add to what Neeta is saying, right, and that's a very real, it's a realization, and it's a very real realization saying that when you're operating in a low capacity environment, there are things that you would need to do differently, right? And there are various levels at which this operates. Say, for example, if you look at just the interface level as well, right? When you're designing the app, can you reduce 4 clicks to 1 click? Right, and that is something that actually happened. And Mrinal worked on that, for health campaign management, saying, can we reduce the load for one person, saying that to be able to go and submit or select the number of bed nets, for example, that need to be distributed, or the number of people in a household, can we change that from 4 clicks to 1 click? Right, it would happen at that level. It would happen at the level of, hey, if we go and design our registries well, can the same registry now be used across multiple campaigns? Which means that, can you go and look at enriching the registries instead of doing enumeration over and over, the whole enumeration process again, which is a significant part of time and effort that goes into a campaign, which means now that you can reuse and redeploy those resources for something else, right? So it's those are how we look at, when you frame the question as Neeta did, saying that, hey, this is a low resource environment, what are the various levels at which we can go and solve this problem? So we look at it right from the interface level all the way to how a campaign can be thought through itself.
There is another question from Pramod regarding the sharing of this webinar and presentation, which we will do. And I think there's another one from Adama, which is, what specific challenges do you face in terms of user adoption? Which I think yet to be seen. But I think it might be worthwhile, Mrinal, to share the user adoption which you did in Mumbai, because Mozambique was a bit delayed. We would have done the same there, but in the meantime, you did in Mumbai. I think that story might be good for us to hear.
Yes. So I'll just give like 2 instances to drive home this point, right? The first was regarding the challenge itself. If the application is more difficult to use than your regular paper and pen approach, then obviously we have some friction getting adoption going. When we were in Mozambique, a lot of field teams faced a particular issue that the data that they collected could not be synced with the server. After going into the details, we checked what was happening, we identified the root cause, and we solved for that. Once they were able to quickly collect data without any errors in the data collection itself or the calculations, and send it to the server as well, we found that the teams actually started liking the application. Then similar instances were also captured during the field visit, which we did. We validated that during the Mumbai Health Center usability test. Whereas if the application, like Jojo said, if it acts as a co-pilot, it helps you do your job better and does not actually be another task in your task list, then adoption is more, it's more possible for the user to actually start engaging and using the app, and the adoption problem gets solved. So I think these 2 points were like starkly in my mind when this question came up, and thanks for that question.
So just to add to that, I can just add a little bit on that. We've not, like Neeta said, it's to be seen on what happens to adoption and how we face it. But I think the few checks that we already kind of have put in place is saying, what data can we look at, right? Even before the campaign has gone live, while the campaign is running, that tell us about an adoption challenge that the teams at the supervisory level and at the national level can actually address immediately. Say, for example, simple things like how many devices have actually gone live, have been set up versus how many should have been set up by a certain time. Or if you're looking at the end of the day, say at the end of day one of your campaign, what percentage of your data is actually getting synced versus what percentage of your data has not gotten synced, right? So while it's not perfect, but I think it gives us a very, very good idea of saying what is happening in real time in a completely disaggregated manner, because what you're looking at is a federated structure, right? So there are obviously, national, province, then you go down to a district and you go down to finally, a village level team. Can you get data to that level where it's truly actionable, right? That's what we set it up for. And this will be a good learning for us as well.